Okay, I'm sure more people will join us, but for the sake of time, I want to go ahead and kick us off here. Welcome to our Systems for Action Research in Progress webinar series. My name is Carrington Lott. I'm the Deputy Director at Systems for Action, which is a national research program office funded by the Robert Wood Johnson Foundation, and we are housed at the Colorado School of Public Health. One of the main things we do at Systems for Action is develop and release annual funding opportunities that research teams from all across the country apply for. And we are looking to fund research projects that have innovative system alignment mechanisms. So we're looking for research projects that align the medical, public health, social service sectors with the goal of dismantling structural racism, as that has been a specific aim and interest for the Systems for Action program for the past few years. And so it's all wonderful projects that are looking at systems alignment mechanisms, but they're all across different topic areas. And we have a portfolio of about 40 plus research studies that we funded to date. And the team that you're hearing from today is based at the University of Minnesota, and you're going to be hearing about their project titled Youth-Driven Systems Alignment Intervention to Advance Health Equity Among Youth Experiencing Homelessness. This research team applied for a pilot award back in 2022, and they received funding for 12 months to do a research project to test the feasibility and acceptability of their systems alignment idea. And it proved to be very successful, and they applied for an impact award in 2024 and received funding for 3 years to evaluate the impact of their system alignment mechanism. So that is what you're going to be hearing about today. This 3-year award started in September 15th of this year, and this is their first time presenting in the Research in Progress webinar series with their new award. So I'm sure they're going to reference perhaps their impact or their past development award during this hour, but we're happy to continue working with them and to get to learn alongside them. Jan, I think you're driving the slides. Can I get you to go to the next one, please? Perfect.
Yes.
Thank you. So just a roadmap of what you're going to be hearing about today. We're at the welcome here right now. I'm about to turn it over to the team because that is what you came to hear about today. But before I do that, just a couple of housekeeping items. We are recording today's session. We will email out the recording as well as the PDF of the slides and any other resources that are shared during today's session. And then we will also reserve some time for questions and answers at the end of today's session. So if any questions come up at any point during today's presentation, please locate the box at the bottom of your Zoom screen that has the Q&A title on it. Click on it, put your question in, and we'll make sure to reserve some time to answer that. Okay, Jana, I'm going to go ahead and hand it over to you, and I think you'll probably do some introductions, and then you'll run through the rest of this roadmap.
Awesome. Thanks so much for the warm introduction and background. My name is Jana Goretz O'Brien. I use she, her pronouns. I'm an adolescent medicine physician by training with a master's in public health, so I wear that hat as well. And we're here at the University of Minnesota. Actually, I want to give a heads up that I'm actually at the Bridge for Youth today, which is one of the community partners we work with at the local youth shelter. So there are youth here in space with me physically, so that I may get a knock on the door. We will be flexible if that occurs, but I'm here in our local clinic. What are we talking about? We are with the Youth Health and Housing Lab, and we have a number of members of our team here with us in the Zoom space as well, who I'm going to invite to introduce themselves here momentarily. One of the ways that we do work that I'll share a little bit about is called Youth Participatory Action Research. That's a framework that we use that guides our work and is kind of at the core of what we do, which means that young people and youth with lived experiences are directly involved in every single phase of the work, from planning the research to implementing, to developing interventions, to studying them, analyzing them, and disseminating the work along the way. So whenever we present, we always present alongside youth who are here, and I just want to extend some gratitude and love and just like a whole lot of good energy, whatever it is, to the youth who are on this call with us too. And we will all introduce ourselves. So I'm going to pass it along to Zainab to introduce herself, and then we'll just popcorn around so you'll meet the whole team. Zainab.
Hi, everyone. Good morning. My name is Zainab, and I'm a research assistant for the Youth Health and Housing Lab. I also work as the youth organizer, so I'm really the one working hand in hand with our amazing youth collaborators here. Super excited for us to be here today and just share our work. And I'm really excited for you all to also hear from the youth's perspectives. And I will popcorn it off to Megan.
Thanks, Zainab. Hi, everybody. I'm Megan. I use she, her pronouns, and I'm the Youth Health and Housing Lab Program Manager. I'm going to popcorn to Saint.
Hi everyone, my name is Saint. I go by she, they pronouns, youth leader, a part of the Youth Health and Housing Lab, and I will popcorn to Emmett.
Good afternoon, everyone. My name is Emmett, and I'm also a participant, youth participant for this housing lab as well. I'll pass it to Lexi, if that's okay.
Hi, I'm Lexi, and I go by she, her, and I'm also a participant of this youth group. And I will pass it on to Mary.
Hi everyone, I think that's me. I'm Mary Jane. I use she, her pronouns. I am with the Youth Health and Housing Lab as the project manager for the Youth Health Connect project, and I will popcorn to Barb.
Thanks, Jane. Hi, Barb McMorris, she, her pronouns. I'm a sociologist and in the School of Nursing here at the University of Minnesota, and I'm one of the co-investigators, and I do a lot of statistics for the program. And I will popcorn to who hasn't gone? Lynn.
Good morning, everybody. I'm Lynn Brettel, she, her. I'm a project manager with the Systems for Action Systems Alignment Project and also staff in the Division of General Peds and Adolescent Health at the U of M. I'm going to pass to Camille.
Hi, my name is Camille Brown. My pronouns are she and her. I'm an assistant professor in the School of Nursing, and I am also a co-I on this project. And we'll be helping out a lot with the statistics and some of the analysis. And I will popcorn to, I think Quinzel has not gone yet.
Hi, thank you. Can you hear me?
Mhm.
Okay. Hi, my name is Quinzel. My pronouns are he, him, and I'm with the youth group today. Thank you guys for having me today. I don't know who went.
I think maybe Lo is last. Did I? And yes, got it. Okay, Lo, do you want to introduce yourself? Okay, wrap us up.
My name's Lo. I go by she, her, they, them pronouns, and I'm here with the youth group.
Yeah. All right. I'm really excited to be here. This work is not done alone with the university. It is not done alone with one discipline. It is a multidisciplinary team from a range of backgrounds, ages, perspectives, and across our state too. And I'm really excited about that. I also just want to acknowledge that it takes a lot of work, energy, effort, and love for youth to be able to come here, share their experiences. And I just, again, want to extend gratitude for that work and invite folks to participate, engage as well. All right, cool. With respect to what we're going to be doing today, you've met our team a little bit. We've done some introductions and the welcome. I'm going to share a little bit more background and who we are and how we got here. And then we'll talk a bit about two different systems alignment strategies that are part of kind of an integrated approach to how we bring everyone together and do this work as a team. Then we'll talk a bit about the research plan and we'll talk through what we've done so far and where we're going. So that's where we're headed. I've mentioned that we're part of what's called the Youth Health and Housing Lab. We work with youth experiencing homelessness and multi-sector partners on an array of projects that center a strengths-based, anti-oppressive, trauma-informed approach rooted in a framework called positive youth development. And through that work, we uplift youth voice, we center equity, we practice cultural humility, and we try and do that across every aspect of the work we do. Part of that positive youth development framework is knowing that youth are experts in their own lived experiences and a vital part of any solution constructed to provide them with resources and guidance aimed at improving their health and well-being. So we do this work with and alongside young people and multi-sector partners at this intersection of housing and health and healthcare and public health. We work as part of a multi-sector team. So you've met a bunch of members of our U of M and Youth Collaborator Board here, but again, we're not doing this work alone. We're working with partners from across the state, from youth serving agencies, healthcare organizations, 3 different government agencies, Minneapolis Public Schools and Minneapolis School-Based Clinics, and then of course our research team too. So this is really a collaboration, and with youth, the goal is to put youth at the center of that multi-sector collaboration and uplift youth voices. I use this term already. You're going to hear me use it a lot. This term of youth participatory action research, or YPAR, is kind of a way to say this for short. And again, this really kind of is the underpinning of what we do. Youth are involved in every phase of the work, and we see them as collaborators in the research from start to finish. By way of background, just in terms of why we're doing this work, 4.2 million youth experience homelessness annually in the US. These are similar rates across rural, urban, and suburban areas. So in our state especially, we actually have almost exact prevalences when we look at students experiencing homelessness across the state. That's about 6,000 in our state every single night, young people who don't have a place to consistently lay their head. When we talk about youth experiencing homelessness, we are talking about a range of experiences, not just what people might envision. I think sometimes when I use the term homelessness, people envision what's in the background of this photo, someone camping in a tent or sleeping on the street or panhandling. But for young people experiencing homelessness, that can include a range of other experiences, like running away or being thrown out of the home, sleeping on the street, staying in a shelter, and very often couch surfing or bouncing around with friends in other places because they don't have a place to stay. In fact, when we work with youth and we talk about the term homelessness, not only is there a lot of stigma associated with that term, but many young people who are having these experiences and facing these challenges may not use that term to describe themselves. So we try and use an inclusive definition that really reflects the range of experiences of housing instability that young people may face. So I mentioned this term YPAR, Youth Participatory Action Research, and we use a range of strategies for engaging youth, engaging with youth. Youth leaders are co-presenters and co-trainers. When we develop trainings, we co-present with youth, and they also co-present every element of academic dissemination and community dissemination we do. We have an action board of youth collaborators. You're meeting some of the folks who have driven the interventions here today and who will continue to drive those interventions in the future. That board is now meeting once monthly or sometimes twice monthly to do this work with us. And again, they consult on everything we do and also drive the work forward as key collaborators here. There's the more classic kind of stuff like focus groups and interviews. That's often what people think of when they think about engaging youth in research. We think about collecting data through surveys and focus groups with young people. On our team, like I mentioned, we work with kind of a multi-sector consortium that meets monthly. Youth also participate in that, and that's an opportunity for young people to really be at the center of conversations to drive forward systems and structural change and interventions that they've co-designed and collaborated. So again, we're trying to use a range of ways to engage with young people that work for them, and we're working to expand that across the state, and we'll share a little bit more about that. Before I dive into the nitty-gritty of the research, I'm going to ask Zainab to facilitate our first youth question for youth.
All right, thank you, Jana. So the question I will be raising to the youth now is, what does it look like from your perspectives for youth and others with lived experiences to meaningfully engage in research, and why is that important?
Thank you, Zainab. Emmett here again. And I really appreciate this question because it's centering the voice of those who are left in the shadows. And I think that it's extremely important for folks with lived experience to be at the research from the beginning to the end. There's so much that happens at like disseminations that sometimes people's voices don't get heard. So knowing that there are other ways to elevate youth's voices, as well as like bringing them to conferences, as well as just giving them a platform to really share their story and cultivate their narrative so that they can discover their why. We all know what we do every day. Some of us go to school. Some of us work jobs. These are the things that we do, but not everyone understands the why of what they're doing, and being able to meaningfully engage in research can and has helped me discover my why along the way as it's still evolving. And so that's why I find it so important to really center folks with lived experience so that transformation can truly happen.
I'm seeing a lot of hearts floating by. Thank you. Zainab, was there somebody else who was on this? I don't want to interrupt, but or should I move on to the next?
Yeah, we were gonna have another youth perspective.
Are there any other youth want to share? Saint.
Hi everyone, Saint here. For me, what it looks like from my personal perspective to meaningfully engage in research is honestly what I've been doing with youth health housing lab. I'm sorry, I'm so nervous. I'm so nervous today. I can't. I'm gonna have to pass this off. I'm gonna have to pass.
That is okay. And there is space. I just want to name, like, we're all human. This is hard stuff to talk about. And if you need space and we need to pause, that's okay. And we're a team, so we can cover each other too.
Yeah, it sucks because I was really excited to answer this, but I've seen how many people are in here now. I'm just panicking. So
No,
I'm gonna have to pass.
That is totally fine, Saint. And thank you for communicating about your needs too. And that goes for everybody. If there's folks who are like, nope, this is not the date, that's okay. Thank you.
Yeah, thanks.
All right. Okay, I'm gonna move us along, and I'm seeing a lot of hearts and love here. So again, thank you for those who are willing to share and also for being here as part of this community. All right. So again, just shifting the focus here a little bit away from images that are kind of more common conceptions of young people. When we think of youth homelessness, some of these common images that come to mind, really thinking about youth with lived experience of homelessness is looking like every other youth as a remarkably resilient and also diverse population of young people. So kind of shifting that frame. I'm going to speak a little bit about the drivers of youth homelessness. So youth homelessness is not an accident. It is a result of multiple structural forces and inequities that have been built into the fabric of our society and the way that our systems are built. So when we think of homelessness, often things like low wages, rising costs of living, and intergenerational poverty, which are a direct function of systemic racism and oppression, are key drivers. Similarly, limited education and employment opportunities are a key driver. We know systems involvement, including the justice and the foster system, are key drivers of youth homelessness as well. I want to point out that this is bidirectional. So youth homelessness is criminalized in many states, and as a result, the acts needed to survive while somebody is experiencing housing instability are also criminalized. So as a result, youth who are experiencing housing instability and homelessness may be more likely to land in the justice system. And likewise, folks in the justice system and also the foster system may be more likely to end up unstably housed or homeless as well as a function of those systems. Domestic violence, intimate partner violence and abuse, and also a lack of affirmation of one's identities in the context of transphobia and homophobia embedded within families and culture and society also are key drivers of this, of housing instability and homelessness for young people. And then I want to acknowledge the immigration and global crises as a key driver as well. Climate crises and other global crises have really led to a lot of displacement of adolescents and young adults functioning independently without an adult around. And I want to point out that today we're really going to be focusing on youth who are unaccompanied while they're experiencing homelessness. And that means youth who are living independently or living apart from a parent or guardian. I also want to highlight that youth homelessness disproportionately affects BIPOC youth. 73% of youth experiencing homelessness are BIPOC. 23% of youth experiencing homelessness identifies LGBTQ+. This is disproportionately higher than the general population. And again, this is not a surprise. It's a function of structural and embedded inequities within our systems. And I want to acknowledge that there is a lot of trauma and adversity that happens at the hands of the very systems that aim to serve youth, and that youth are remarkably resilient in the face of that trauma and adversity. And I want to acknowledge that many of the sectors that are involved in this, including sectors that I'm a part of, the healthcare sector, public health, academia, education, and the housing sector have all been part of perpetrating some of this harm as well. So we need to really be mindful of that and aware of our own positionality and power, and also mindful of that legacy of mistrust that is built up. That's a part of why we do this work, to rebuild the trust together and to help dismantle some of those broken systems and center youth voice when it hasn't been. So thank you to Emmett also for speaking to that. We have another youth perspectives question here. And again, I'll invite you to participate, but there is no pressure to. If you're not feeling it today, that's okay. Zainab, do you want to share and facilitate this conversation?
Yes, thank you, Jana. And I want to echo again what Jana said. We just want to ensure that whoever's voices wants to be heard will be heard in this space today. And whoever decides to take a step back, that's totally okay. We're all human here. And the fact that you're even on this call is amazing in itself. So thank you all for being here today. So the next questions that we have for youth to be answering now is, who are youth experiencing homelessness? And what do you want researchers and public health professionals to know or understand about youth experiencing homelessness?
I do apologize if that was supposed to be my turn. I had lost service.
It's all right, Lexi.
Oh, sorry. Are we doing the first or second question?
You can
Whichever
answer
you
any
want.
question, yeah.
Okay, so the second question is most what I was looking at the most for my personal experience. I just wanted to put out that I think that what researchers should really be looking at nowadays with homelessness and young people and the youth, sorry, nervous. Okay, so many homeless young youth are experienced that from being kicked out for, being part of the LGBTQ community, being, families just, saying you're too old, leave, and we are struggling. And I believe that, oh, sorry. I just believe that, young youth that are homeless don't get what they truly need for mental health in general, not just shelters. We have many shelters that do help young folks, but it's not just about having a shelter also, it's also about what their mental state is at. And I believe many youth are struggling with that, a big struggle with that. And it's hard to get back on your feet, and it's not, sorry. I just believe that, we got to really focus on mental health is the big part, especially now. Like, a lot of people don't really tend to focus on it, but I believe that we should, and that it should be more pushed with more groups, just like this one. I mean, just being a part of this one also has helped a lot. Personal experience as well. And it's physical health also. I mean, a lot of young youth don't get the help they need for physical health in general, so they end up mentally and physically sick without that money that they have. We don't just can't just, it's hard, and it's hard to get a job, and it's hard to live when you're homeless and you don't have anyone. And having more groups and more people to bring together for these youth would be a big help to many young people, and I think it's just the best idea for that.
Thank you so much for your words.
Thank you, Lexi.
You're welcome.
I'd also like to chirp in on this question. For the first part, where it's asking, who are you experiencing homelessness? I just first want to address the word homelessness. There's a trillion different definitions depending on who you're asking. HUD has a different definition. The states that at large have different definitions. And just like being one with that fact is important, because it kind of just provides context for what it is you're looking into. And so when it comes to like youth experiencing homelessness, I'll talk a little bit about my story quickly. I was emancipated in high school, and here in Minnesota, we don't actually have a formal emancipation process. So I was able to just get some papers notarized, and that was how I kind of just became independent from my parents. And that was back in my freshman year of high school. So I ended up learning how to wear a mask really, really well. I went to school out in an affluent suburb of the Twin Cities and lived at the shelter downtown Minneapolis. So my school would bus me out each day. And knowing that I was going to school with kids whose parents were doctors and lawyers and CEOs, and meanwhile I was, coming to school digging through the lost and found because I had on the same clothes from yesterday. It really makes you stop and think, like, can anyone just identify a youth who may be homeless? And um, I think it might be challenging. And so, like, I just wanted to paint that picture that survival mode is a real thing, and learning how to turn it off is it's a process. And I really appreciate Lexi bringing up the point about like getting some kind of physical exercise and formally it's important, and um, it goes a long way. And so I just wanted to, yeah, chirp in and say youth who are experiencing homelessness could be far and wide. You never really know whether you're living in the rural area or the city. This idea of putting on a mask, it doesn't have a border. Youth learn how to navigate so that they're not, in the limelight, because it feels shameful, having to experience homelessness. And so that could look like couch hopping, that could look like doubling up, that could look like sleeping in the parks. These are all things that were true to myself. So just I hope someone is able to get a clearer definition of what homeless could mean based off my answer.
Thank you so much, Emmett.
Thank you. All right. So I think we've heard this loud and clear, and this is a Robert Wood Johnson Foundation kind of framing, but health begins where we live, learn, work, and play. So if a young person doesn't have a stable place to stay, I think it's obvious from what we're hearing from young people, there are a lot of health risks associated with homelessness itself. One thing I'd really like to highlight, though, is that the health risks aren't necessarily associated with the experience of housing instability necessarily, though that certainly compounds that risk. These are also health risks associated with exploitation, with incarceration, with foster care involvement, all of which are more common and with racism and sexism and transphobia and homophobia, all of which are more common in the context of marginalization and trauma. So when we talk about the increased health risks and how we aim to tackle them with the interventions we'll highlight today and what we're doing with this grant, we're really talking about mitigating risks associated with marginalization and trauma and with a historical exclusion from systems. So violence, injury, abuse, sexual health risk, untreated medical conditions, increased mental health risks, substance use, barriers to care, and unmet basic needs are all functions of that embedded structural oppression and also these experiences that intersect with one another. We know that youth experiencing homelessness have higher rates of serious medical conditions and serious mental illness and physical health conditions that go untreated, as well as substance use disorders as well. And that they have many barriers or face many barriers to accessing care, which was a big thing we looked at and in our first development grant with RWJF. I do want to invite youth again to just share any additional insight they want to about challenges youth experiencing homelessness face in terms of accessing healthcare and public health. Sorry, Zainab, I read the question because I got excited.
It's all right. Whichever youths want to pitch in, please feel free to do so. And thank you again for sharing your voices and stories with us.
Hi everyone, Saint here. So I can really answer this one. What challenges do youth experiencing homelessness face in navigating the healthcare system? So for years, I've struggled with my mental health. And I've had trouble accessing a therapist that I feel resonates with me or sees me on a level that's human rather than just someone to diagnose with something. And so oftentimes, even still, it prevents me from wanting to seek help or reach out to anyone regarding my mental health and my struggles. I feel like a lot of times people leave humanness at the door, leave humanity at the door when they get into professional spaces. And that's kind of the last thing we need, especially when dealing with youth who've been severely traumatized or just gone through really hard things, especially dealing with homelessness and like oftentimes like personally wanting to not even be here anymore because we just feel like that's it, that's all, like there's nothing, there's nowhere to go from there. And I have a lot of um I think healthcare trauma, or not, I'm not going to say healthcare trauma, I think hospital trauma. There's been so many times where I've had things wrong and my needs weren't met or they were pushed off or brushed off as like nothing because I think honestly healthcare workers are burnt out. And despite being burnt out, I think that if you could connect with someone just human to human as healthcare providers and see that all we need is to feel connected to one another and just really see that person as someone that is possibly struggling with something you've struggled with, that it can make everything all the better. I know that navigating the healthcare system is difficult for more than just youth, but especially youth because oftentimes it feels exploitative and just having trouble accessing I don't know, like insurance and stuff like that. Like it's very difficult and it's overwhelming and it's intimidating. And I even still have like trouble just trying to set up my dentist appointments or like doctor's appointments because I'm terrified that if I do, like I'm not gonna get the help I need or I'm not gonna be validated in my struggles. And I don't know, I feel like I don't know a way around any of that because I know people are gonna be people and everyone's kind of a case to case situation, especially in the healthcare field. But I'm very grateful to anyone in here that does take the time to see people for who they are and the struggles they're going through and validate those, especially youth, because we need that. A lot of us grew up being invalidated and it's just, yeah. But thank everyone for being here and that's all I have to say.
Thank you so much, Saint. We really appreciate you.
All right. I'm going to move us along, saying thank you again for speaking up. Thank you, Emmett, everybody who's spoken so far. I appreciate you. All right, so in our initial work with the development grant, a lot of the work we did was around identifying what those challenges were that youth face in navigating healthcare systems, and this involved an iterative process with youth, with our multi-sector partners, with youth serving agencies, and they identified many barriers to care that I think, honestly, Saint, Emmett, Lexi, you all articulated so well and detailed so well. It's such wisdom, with such wisdom and grace, but the affordability, the transportation barriers, the how to access the care and the records and that like navigating systems knowledge that is so difficult in an overly complicated system, as well as rightful mistrust and trauma and harm at the hands of systems, as well as confidentiality. So thank you all for speaking up. And again, we work across systems. Youth work across, interact with a number of systems of justice, the foster housing systems, healthcare, schools. So we all need to work together to really think about multi-sector solutions to dismantle some of those silos and center youth voice across those silos. And that's really what we're aiming to do. So let's spend the second half of this conversation. We think that background is really important so you can get a sense for why we do the work and what kind of work we do. Now I'll share some of the youth-driven systems alignment interventions that came out of our development work. So the current research study, the one that we were funded for with the impact grant, was youth participatory action research to address structural racism by one, implementing youth-driven strategies for systems alignment, and I'll share what those are now. And 2, by centering the voices of youth experiencing homelessness with a focus specifically on BIPOC youth within and across systems from which they have been historically excluded. So I want to highlight here, there's both the interventions themselves that were driven by young people that we will be talking about, but then there's also this notion of the actual intervention, like the youth participatory elements and the centering youth voices is also an element of the intervention to dismantle structural racism. So this is a little bit of a unique concept in that the methodology is a part, and like the way that we do the research is a part of how we dismantle structural oppression. So this notion of just centering youth voice itself is really critical. In our first study in the development grant that ended earlier this year, the year-long study that Carrington mentioned, we identified youth healthcare needs and priorities, as well as barriers to care when we engaged youth and community in that needs assessment and in a systems mapping process. We then built out an implementation plan to improve systems alignment and to address these needs, and we implemented those plans alongside youth and community partners. We'll talk about what those findings were. Then we did an initial evaluation of the systems alignment interventions that youth developed with us in real time, and then we disseminated and translated some of that work into action. And now, those youth-driven systems alignment strategies included 4 strategies, and we're focusing on 2 of them in this current impact grant. One of the strategies is trainings for youth serving agency staff and healthcare professionals. A second is Youth Health Connect, which is a digital community health resource map, and is the focus of our aim 1 of this research. A third intervention is expanding mental health supports for youth, and that includes embedded traditional and non-traditional mental health services and supports within community and within youth serving agencies. And a 4th youth-driven systems alignment strategy is improving and expanding site-based health services for youth experiencing homelessness. So we're working on all 4 of these strategies, and then at the same time, we're working to evolve and improve the data systems that support the systems within which youth interface and leverage large data sets. And that's really the focus of aims 2 and 3, to drive structural change and also to translate research and large data into action. So again, there's 2 main areas of focus in this impact grant. The first is really diving deep on Youth Health Connect, which involves both training up youth serving agency staff to better support youth in navigating across health systems to address some of the barriers we mentioned. And then this Youth Health Connect website, which we have a QR code to here that you can use, is a digital resource map that allows youth to filter and search by both a type of health resource, but also by identity. So they could say, hey, I'm an Indigenous youth that's looking for a queer-friendly space, and I'm searching for gender-affirming care. And they can search and then find that resource on a map. So this map is currently in its prototype form, and it's primarily focused in the Twin Cities metro area. We're looking to refine that map and that digital application and scale it across the state. You'll also see on our interface, our initial interface here, we have additional section for healthcare rights and things to help clarify the legal rights that youth have in terms of navigating the healthcare system too. And then I'm going to go to one other thing, and then we'll come back to this question. We will also be working on data systems alignment. So how do we create data systems that are more equitable and that are more centering of young people's voices? And how do we leverage large data sets that currently exist that include youth data to translate research into practice and action? So I'm going to ask youth another question and invite youth to participate here. Zainab, do you want to facilitate this one?
Yes, thank you, Jana. As Jana was saying, one of our main goals is to really grow Youth Health Connect and make sure that it expands into not just the Twin Cities, but into greater and rural Minnesota. So one main question that we have for the youth is, how do you think Youth Health Connect could help youth experiencing homelessness? And this is also a question that we ourselves keep in mind when we're continuously evolving this app.
Hi, my name is Quinsdale, and the first thing I want to say is the app is it's very good for youth in general. This app is a very good way to see what healthcare options they have available to them at the moment. Youth Youth Health Connect is a good way for youth facing homelessness to get the resources they need in the healthcare that they need. Also, some examples are primary doctors, dental care, mental health, healthcare rides, and so much more. And I also want to say I was homeless for 4 years. I didn't have the resources that this app is providing. So I'm really passionate about this because I want to help youth get the resources and the things that they need to better their lives and to actually just do great in life. That's it.
Thank you so much for your words, Kunzel. We appreciate you.
Zainab, is there one other person or should I move on?
If anyone else would like to pitch in, feel free to do so, or otherwise, we can move on, Jenna.
Okay. Okay.
I just want to say quickly that this is like something that's way overdue. And so I'm so excited and eager that it's actually started and it's out and it's much needed. And I'm especially excited about the expansion toward the rest of Minnesota. I have a lot of friends and family that will also be probably most likely using the website.
Thanks, Emmett. That's really good to hear.
Thank you, Emmett. And I do want to acknowledge that this is not our idea as a lab. This is a result of an iterative process. And actually, youth were the ones who initially said, we kind of want something like a Yelp for health services and for public health, where we can have kind of a one-stop shop. So what we're doing is working alongside youth to implement an intervention that they co-developed alongside us and will continue to refine with us. So again, credit where credit is due. Okay, I'm going to dive a little bit into the research plan itself. We're still very much at the beginning of this 3-year project in the first few months here. I'll go aim by aim here. So the first one we'll talk about is aim 1, which is primarily focused on Youth Health Connect's feasibility and effectiveness. So this will start, it's a mixed methods evaluation. It will start with focus groups with youth and youth serving agency staff that really focuses on refining and key informed interviews with youth serving agency staff to refine and scale the website itself. For those of us in the Twin Cities Metro, that'll primarily focus on refining the app to better meet the needs of youth who are here. For those in what we're calling regions 2 and 3, so small cities and rural areas, this will really work on expanding the base of resources in the app and refining the app to better meet the needs of youth in rural and greater Minnesota and rural and small cities, which we've heard from youth already that there's some varying needs that we really need to be thinking about in those communities. We're going to evaluate Youth Health Connect using a step-wedged mixed methods approach. We're looking to recruit a total of 160 youth, 50 to 60 in each region. So that'll start with 60 in the urban area in the Twin Cities Metro, where we already have the map developed. And then 100, so 50 from small cities and 50 from rural areas, though we envision that will be driven by our recruitment. Sampling specifically for a sample that is greater than 70% BIPOC youth to reflect the diversity of youth who experience homelessness in our state. So we're doing kind of by phase, by region, starting with an area where we already have the map built. And then while we're implementing in that region, we'll be scaling the map up to greater Minnesota, smaller cities and rural areas, and then recruiting for youth in those areas. The whole way along, we're hoping to have a youth board comprised of youth from across the state to be driving this work and continuing to look at what we're hearing from youth and refine the app along the way. For youth, as we're testing, we'll be doing surveys at baseline, 1 month, 3 month, and 6 months. And then we'll also be test driving with youth serving agency staff like case managers and homelessness liaisons in the schools as staff members who may use this app or use this website to improve health and help youth connect with youth resources. And we'll be looking at effectiveness, specifically focusing on mental health equity, health literacy, access to care, utilization. And we'll be looking at some measures of feasibility and implementation. So looking at how acceptable the app is and how the design of the website is and how youth feel it works for them. And then for staff, what can we be doing better to actually implement this in a way that works for them and aligns with their needs and their workflow? Okay. The other element of mixed methods evaluation are focus groups. After about 4 to 6 months of implementation in each region, we plan to bring youth together and youth serving agency staff together to kind of take a deeper dive into their experience with the app and their perspectives on how it could improve, and also how we can improve, and also what their perspectives are on how it has impacted their lives. And that qual evaluation really allows us to interpret the quantitative piece and see its effect in a different kind of way with a deeper dive. Aim 2 is focused on youth-driven and trauma-informed data collection practices and data sharing practices here. This was another focus and key element of what we heard from our data systems alignment planning in the development grant. So we heard from youth that they really wanted the process of data collection at youth-serving agencies and within healthcare settings to be more driven by young people's voices and perspectives, and to be in control of youth with lived experiences of homelessness and youth who are interfacing with those systems. And they really wanted to see the systems evolve and better connect with one another. So to better share across systems and across sectors. In full disclosure, this is a harder aim that's going to take a lot of bringing folks together from different sectors to do this work. It will start with a qualitative process with youth. Many of the youth leaders here will be a part of that process, and with our multi-sector team to map existing data collection and sharing practices across different sectors. And then again, centering the voices of youth and of our multi-sector partners, within our multi-sector partners, really develop a set of best practices to implement those practices in years 2 and 3, and then to assess the feasibility of these practices and sustaining them, and think about how we need to improve or refine them further. Our goal is that when data is collected, those data sets can be more informed by youth voice and youth perspectives, and then that those data can be leveraged to identify gaps, identify inequities, and then also to improve the care that we're providing in an iterative way. So in some ways, having those data that youth have informed allow us then to drive policy and practice and identify where resource gaps exist. And then finally, research aim 3, and this is really where I think Barb and Camille's expertise come into, so I'm glad to have them on our team, will be to identify key youth-driven research and policy questions that can be answered with existing large data sets. So for instance, we have a statewide survey of students across Minnesota that asks some key questions about housing instability and homelessness, and also some key questions about health and healthcare. And yet to date, we don't really have information or knowledge about what the specific inequities that subgroups of youth experiencing homelessness may face. So for instance, what are the specific health needs of LGBTQ+ youth, of Indigenous youth, of youth living in rural areas? We've heard from youth as part of our initial development grant that these kinds of questions are really important to them and can be used to really highlight where there are resource gaps and needs, and then to bring that and translate that into action at the state level and at the institutional level. So our goal here is to, again, engage with youth leaders, and then to leverage large data sets of thousands of young people with lived experiences of homelessness to answer these questions, and then engage in an iterative consensus building process to interpret these analyses with youth and translate research into action. So again, 3 related aims, but that operate independently to dismantle systems or inequitable systems. With that in mind, I'm going to share a little bit about what we've done so far. Zainab, do you want to share a bit about where we've started? A lot of these first 3 months have been centered on partnership development, scaling, and youth engagement. So Zainab will start by just sharing a little bit about youth engagement, and then we'll wrap up together and do some questions. Zainab, yes.
Thank you, Jenna. Yeah, so what we have is the Youth Collaborators Board, and basically this is a board of youth from the Twin Cities, and also we are working on expanding into having youth join us from Greater Rural Minnesota. We have Lexi here today, and she's from Bemidji, so we got 1, and hopefully with our continuous work and collaboration with community partners, we'll be able to grow that number even more. So basically what we're doing in this space is working on responsibility outlines and expectations, just to ensure transparency and accountability among us as a lab and with our youth collaborators. And also just creating a supportive environment to make sure that the youth voices are really centered, and that we're really taking into account what they say and what they want from the work that our lab does. building skills such as leadership, work ethic, and communication as we expand on work. And another cool thing that we really do together is co-creating recruitment and collaboration strategies. Our youth collaborators are really the ones spearheading the youth participant recruitment, and these youth participants will be the ones that will be pilot testing the Youth Health Connect app. So all in all, we're all growing together, super excited to see our board grow and to continue the work that we're doing. Thank you.
Thank you, Zainab. I also want to highlight that we've spent the last 2 months meeting with partners from across the state to continue to grow in this work. And I want to thank Jane for her leadership in this space specifically too. And you can see here where we started at the beginning of this. When we started, the development project was primarily focused in the Twin Cities Metro, where there's all these little yellow dots. And now these are a kind of our focus of partnerships across the state right now. And you can see that we still have room to grow. We've really been growing our partnerships, and it's been exciting to see, and we're having more engagement from across the state. So again, next steps, we're doing this research together. We're going to keep moving forward. We're working through, we're developing our evaluation plan now, and we'll be recruiting hopefully here in the next few months and doing some focus groups in the next few months to grow our app, or to do our work. I will close and leave some space for questions. I do want to invite youth to speak first, and then I will answer the questions I see in the chat. But how do you hope to see youth with lived experiences involved in the future, and where do you hope to see this work going? And if we're feeling quiet now, that's okay. I can also go on to answer some of the amazing questions in the Q&A that I see waiting. So I want to actually start with the compensation question, just because it's such a critical element here and I didn't mention it. So Callie Tennis from had mentioned, are you able to share about the form and process of how youth participants are compensated? And are there different levels of engagement and compensation? So first of all, I just want to highlight that it is essential to compensate youth for their time, just like we would compensate any other member of the team. Everyone deserves to be paid for their insight and expertise. I also want to acknowledge the youth who are in this group for really pushing us to not only to compensate, but for recognize the emotional burden and the labor of presenting in front of, for instance, an audience like this. So right now we pay youth, just to be totally transparent about funding, we pay youth hourly at $20 an hour. We pay them through, we can talk about the infrastructure and the systems, but we pay them through a clean card system. But they also have the opportunity to be hired as members of the university team if they are interested. And they are paid hourly for participation in the lab. And then anytime they're doing external work, they get paid actually essentially double of what they were paid initially for any external work and speaking truth to power, recognizing that emotional labor and work there too. Julie asked, I don't see libraries listed as partners in the great work. Have you ever worked with libraries, public or academic? And I will acknowledge that this literally came up, I think, yes, like 2 days ago, I don't know, maybe it was last week. And we plan to bring libraries on board for sure, because I think they're pretty essential in this work. Yes, so they haven't been so far, but we plan to bring them on board. And then Edna said, considering the extractive and sometimes distractive nature of research in academia, how is the wisdom of youth acknowledged in the multi-agency research? For example, all the names of participants should be included in the final research, as it is their wisdom that made the research possible. I 100% agree. They are considered co-collaborators on the research. They have the opportunity to publish with us academically. They not only put this on their CVs, we write letters. If anyone is interested in letters of recommendation, we do that too. And we would list them as authors in anything we do. And they come and co-present at academic conferences just like any other member of the team would. I agree, basically, with what you said, fully. The how you did the research in 1 year, it was a whirlwind. We still have a lot of implementation to do. We tried to not have perfect be the enemy of good. We implemented and we iterate and we used an iterative process to continue to improve. Honestly, I think the early evaluation, we just had very limited evaluation early on. I'm hoping over the next 3 years, we'll be implementing more broadly, refining and evaluating more rigorously. So yes. Okay. Oh, I'm asking a lot. There's a lot of questions. All right, slide that outline. Okay. Part of the system change would be paying the youth and other community members equitable salaries similar to staff members. not just honorariums here and there. Wisdom does not mean having a degree. The lived wisdom of community members is worth a lot, which is why researchers want to take part in said research. Yes, I agree. We pay them at an equal rate to other staff members in our lab for that exact reason. I agree. And rather than just honorariums, and they're paid hourly like all of our lab staff too. Does anyone actually, before I'm just answering all these, rattling this off, I'd like to invite the youth to speak to the compensation piece if they are interested, and to the importance of paying youth not only in honorarium or like in like gift card, but in money. Does anyone want to speak to that or why that's important? I've just been rattling off answers.
Yeah, I can speak to that. I see that you guys are very concerned. We've already, as a group, like come to an agreement about how much we should be getting paid. We recently started being paid more. Full transparency. I'm very happy about that because speaking in places like this is very taxing oftentimes because we're sharing our stories and with a lot of people. And I really do appreciate Jana, Zainab, and everyone, Megan, everyone that had a part in that. They listened to us, they took our needs seriously and met them. So yeah, we are getting paid hourly. And
yeah, thank you. I agree fully with Edna's statement, and it's something we're still continuing to work towards and hopefully improve. I think having the team members and our collaborators speak up and also kind of share and advocate around how much they think they should be making and speak up if they felt like it was not working for them was really important for us as a lab. How will the collected data be used and who owns the data? Yes. In this case data is collected from youth in various racial backgrounds and intersectional identities. Yes, so we collect the data alongside our Youth Missing School for today's session. I'll let the youth answer that if they would like to. Yes, they are amazing. The collect database, yes. So the data will be shared by our multi-sector collaborative, which includes the Youth Action Board members who are part of it, and they will have full access to it, and our multi-sector team. The only exception to the full transparency of data is that we will de-identify any data before it is shared with a wider audience. So it'll be a small group of members of the lab team that have access to identifiable data. Most of the data collected will be de-identified to begin with, and then it will be further de-identified before qualitative data or quantitative data are shared with a larger group, and that's by design. So everyone will co-own the data, but it will be the de-identified data that is co-owned as to not violate the trust of young people who are willing to participate with us, or the agency staff actually, to protect them as well. Yeah, and thank you. They are amazing. If anybody wants to share any of the other requests, I know we're at 11:59, so I want to open up the space for Zainab and also any others to answer any of the questions that are here. And there was a missing school for today's session. Most of the youth on this call are young adults who I don't think are missing school, but they can share if they are. If they care to.
I just want to say thank you everyone for being here today, and I really hope that you all take the time to sit and reflect on what you've heard from our youth today. It's not very common practice to actually have youth come and speak at presentations such as these. So I really hope that you all take that into account and really sit and think about what you've heard today, and maybe even change something about yourself that you didn't know that you were doing. So thank you all. And thank you all for our youth for being here today. Your wisdom and courage is always very much appreciated.
I think I'll go ahead and close us out since we're at the top of the hour. Jana, thank you so much for fielding all of the questions. You made my job as moderator very easy. And it
Sorry,
was
Carrington. I didn't mean to scoop your moderation
totally
job.
fine.
Thank
I
you.
love that you did that. It was great. But thank you for coming and presenting. Thank you to all the youth for coming and speaking up. It really is. I second everything that everyone else has said. It is so important to hear your voices. It's so important for you to be engaged in this research project and for your voices to be heard. So thank you. Thank you so much. And we will follow up with the recording and slides from today. And I think someone also asked about some potential like how-tos or implementation guides or something. So if the team has that, we will also share that in the follow-up. But for now, I think we can go ahead and hop off. Thanks for joining us today and have a great rest of your Wednesday.
Thanks, Carrington. Maybe for a think tank, we'll do that one.
There we go. I like that.
Yep.
Bye.
Thank you. Bye. Thank you.